Assalamu alaikum everyone, this is Arpia and welcome to the platform of Pharmapedia once again with a new video of drug that is Montelukast, and this is the drug 12 of the drug series. So let's begin the video. Montelukast belong to the drug category that is Leukotriene antagonist. So what is the Leukotriene and how it's antagonize the Leukotriene? This is basically the complex picture. So let's understand from this picture. Phospholipids converted into the arachidonic acid, and it undergoes to the two pathways, that is a COX and the LOX pathway. By the COX pathway, it forms the PGs and thromboxane. PG is basically the prostaglandins. And by the LOX pathway, that is a lip oxygenase pathway, it forms leukotrienes, and this is the Leukotriene. Leukotriene is a brand name of Montelukast. Leukotriene inhibit this step, and it inhibit its binding with the leukotriene receptor. So basically it antagonizes the leukotriene activity, bind with the cysteine leukotriene receptor that inhibit the asthma symptoms that are causes the bronchoconstriction, increase the mucus secretion, increase the vascular permeability, and causes the edema. So ultimately there is no asthmatic symptoms because Leukotriene, that is a Montelukast. Montelukast inhibit the cysteine leukotriene receptor, and in the previous picture as you can see, it inhibit the cysteine leukotriene receptor, and here you can see the cysteine leukotriene, that is a LTC4, D4 and E4. So this is the basic picture of cysteine leukotriene receptor antagonism. Now its pharmacokinetic properties, that is absorption, distribution, metabolism and elimination pattern. Its bioavailability is 64% and its peak plasma time it's in the tablet form with the 3 to 4 hours. It is available in the chewable tablets, and it's a granules form. In the granular form, its peak plasma time is 1 to 3 hours, and it's a chewable tablet 2 to 2.5 hours. Its distribution, it is highly protein bounded, that is 99%, and its VD, that is a volume of distribution, it's 8 to 11 liter. This is basically the pharmacokinetics parameter as you learn in the pharmacokinetics. Now metabolism, it is metabolized by the 3A4 enzyme. Most of the drugs are metabolized by this enzyme, so it is highly interactive drug, and cytochrome 2C9. Now its elimination pattern, half-life is 2.7 to 5.5 hour, and clearance is 45 ml per minute. Excretion in the feces, which is the major route of excretion, that is 86%, and in the urine 0.2%. So in the pregnancy, no evidence of the risks in human, and in lactation caution must be advised, but it is quite not safe but indicated in the pregnancy. Now its indication, add-on therapy to the mild to moderate asthma inadequately controlled by inhaled corticosteroids and short-acting beta-2 agonists, exercise-induced bronchoconstriction. Now its dosage in adults, 10 mg daily at the bedtime. It is taken as HS, that is a bedtime. As a pharmacist, you should know what is the meaning of HS. HS means bedtime. With or without food in the children, and the P dosage is prophylaxis in asthma, 6 months to 6 year, 4 mg once daily, that is means OD in the evening. 6 to 12 years, 5 mg OD in the evening. 15 to 18 years, 10 mg once daily, that means OD. Children, symptomatic relief of seasonal allergic rhinitis in the children with the asthma of 15 to 18 years, 10 mg once daily in the evening. Precautions: do not substitute for the inhaled oral corticosteroid therapy. That means you cannot switch to the oral corticosteroid therapy. Do not use for the relief of acute symptoms because it can worsen the acute symptoms of asthma especially. Phenylketonuria with chewable tablet. It can precipitate out the phenylketonuria because it contains the aspartate, and this is available in the artificial sweetener. Now, what is this? This is a Church-Strauss syndrome, and in this condition, you can use this drug with more and more precautions. And this is basically the inflammation of the blood vessels, so there is no blood flow even to the lungs, and it can see in the patient of asthma, then this syndrome can precipitate out the asthma. Montelukast also induced this syndrome, that is a Church-Strauss syndrome. Now its interactions are phenobarbital with phenytoin and the rifampicin, because these are the candidate for the enzymes that are cytochrome 3A4, which are the enzyme required for the metabolism of Montelukast. Now its major adverse effect are abdominal pain, headache and thirst. Now what is a tip point? In Pakistan, Montelukast is available with the brand name of Mytica. And that's all from this drug and from this video. Until